If you love your penis, this article is for you. I'm Dr. Reena Malik, a urologist and pelvic surgeon, and I spend a large part of my career helping men take better care of one of the most important and often misunderstood parts of their bodies. Your penis is more than just an organ for sex or urination. It's a vital indicator of your overall health. Yet, too many men ignore warning signs or engage in habits that can damage their sexual and reproductive function. So today, I want to talk about something every man should know: the 10 things you should never do to your penis. Think of this as your user manual for better penile health, backed by science, medical experience, and a lot of compassion. The first and perhaps most important rule is this: don't ignore your penis. How well your penis functions can tell you a lot about your body's internal health. In fact, erectile dysfunction (ED) is often one of the earliest signs of cardiovascular disease. Studies have shown that within 7 years of developing ED, 14% of men will experience a heart attack or other major cardiac event. That's because the blood vessels in the penis are smaller than those in the heart. So they're the first to show signs of reduced blood flow. In medicine, we sometimes call ED the canary in the coal mine, a warning that something deeper is going on. Strong erections mean your blood vessels, nerves, hormones, and psychological health are all functioning in harmony. When something disrupts that balance, your erections are often the first to suffer. The next thing I always tell my patients is don't try DI treatments on your penis. I've seen it all, from men attempting home remedies with kitchen ingredients to using bizarre tools in hopes of enhancing size or performance. Unfortunately, many of these methods cause more harm than good. One common example is jelqing, a technique that involves manually stretching the penis to increase its length. It may sound harmless, but repeated pressure and strain can lead to microtears, scarring, and even permanent erectile dysfunction. Every urologist has seen young men come in with damaged penile tissue from these methods. Your penis isn't something to experiment on. It's delicate, vascular, and highly specialized. I've also seen men create homemade constriction rings using everything from rubber bands to metal nuts, or even cut up plastic bottles. These objects can get stuck and restrict blood flow, leading to severe swelling, tissue damage, or in the worst cases, gangrene. There's a reason medical-grade constriction rings are designed with safety release mechanisms. If you ever need one, buy it from a reputable source. Trust me, a twin-dye device is far safer than an emergency room visit involving a fire department's rescue saw. Hygiene is another crucial but often overlooked aspect of penile health. Keeping your penis clean doesn't just mean showering regularly. It means paying attention to areas that can harbor bacteria or yeast, especially if you're uncircumcised. Gently retract the foreskin, wash with mild unscented soap and warm water, and make sure to dry the area completely. Neglecting this can lead to balanitis, an inflammation that causes redness, irritation, and discomfort. I've also seen men who couldn't retract their foreskin at all, a condition called phimosis, and as a result, they couldn't properly inspect or clean the glands. While penile cancer is rare, undetected lesions can develop under the foreskin if left unchecked. If you can't comfortably retract your foreskin, speak to your doctor. Sometimes topical treatments can help, but in other cases, a minor surgical procedure like circumcision may be necessary. That said, cleanliness should never mean over-cleaning. The skin of the penis is delicate and sensitive, and using harsh soaps, strong fragrances, or aggressive scrubbing can lead to irritation, microtears, or dryness. You only need gentle cleansing, not industrial-level disinfection. I always tell patients to think of penile skin care the same way you would treat facial skin, with care, mild products, and attention to irritation. Perhaps the most important message I can give is don't ignore pain, changes, or warning signs. If you notice a sore ulcer, discharge, or any new lump or discoloration, don't wait to see if it goes away. These can be signs of infections, sexually transmitted diseases, urinary tract issues, or in rare cases, cancer. I understand that showing a doctor your genitals can feel vulnerable or embarrassing, but early evaluation can mean the difference between a simple treatment and a serious complication. I've seen too many men delay care for months because they felt ashamed, only to discover an advanced problem that could have been prevented with early attention. Remember, any doctor worth your trust should never make you feel judged or uncomfortable. When it comes to sexual health, I can't emphasize enough the importance of safe sex and staying in control. There is nothing sexier than being confident that you're healthy and protected. When you don't have to worry about infections or unintended pregnancies, you can relax and truly enjoy intimacy. That confidence leads to better sex, plain and simple. Always use condoms if you're not in a mutually monogamous tested relationship. Experiment with different types and materials: latex, polyurethane, polyisoprene until you find what feels best for you and your partner. Control also matters during intercourse itself. Many penile injuries happen during vigorous sex when an erect penis bends sharply against the pubic bone or perineum. This can cause what's known as a penile fracture, which is not a broken bone. The penis has none, but a tear in the tough fibrous tissue that surrounds the erectile chambers. It's a true medical emergency. The classic signs are a popping sound, immediate pain, rapid loss of erection, and swelling that causes the penis to resemble an eggplant. If this ever happens, go straight to the emergency room. Surgery within 24 hours offers the best chance of full recovery. Delaying treatment can lead to curvature, scarring, or permanent ED. Lastly, I always remind men to use plenty of lubrication. It's not only about comfort, it's about protection. Friction from inadequate lubrication can cause small tears in the skin, which increase infection risk and reduce sensation over time. A good water or silicone-based lubricant can make all the difference, especially if your partner experiences dryness due to hormonal changes, medications, or natural variation. Using lube doesn't mean something's wrong. It means you understand how to enhance pleasure and protect your body. Your penis deserves care, attention, and respect. Too often, men see problems as something to be embarrassed about or fixed in secret, when in reality, proactive care is a sign of confidence and responsibility. Whether it's maintaining hygiene, practicing safe sex, or paying attention to subtle changes, taking care of your penis is taking care of your health. And as a urologist, I can promise you this: prevention and early attention are far easier than treatment after the fact. When I talk about penile health, I often remind my patients that taking care of your penis isn't about vanity. It's about vitality. Your erections, sensitivity, and even your confidence are reflections of how well your body's systems are functioning together. The penis is unique because it sits at the intersection of your physical, emotional, and psychological health. When something goes wrong, it's rarely just a local issue. It often signals something deeper, whether that's cardiovascular disease, hormonal imbalance, or even anxiety. One of the most important lessons I teach my patients is to never ignore pain changes or warning signs. Your penis has a way of telling you when something's wrong. Maybe it's discomfort during urination, an ulcer sore that doesn't heal, or swelling that looks unusual. These symptoms can stem from a range of causes, from minor infections to serious conditions like penile cancer, which, although rare, can be devastating if ignored. I've treated patients who waited months to seek help because they were embarrassed or afraid, and by the time they finally came in, their options were limited. I understand the vulnerability of showing your genitals to a doctor, but remember, we've seen it all. Our goal isn't judgment, it's healing. Similarly, infections such as balanitis, inflammation of the foreskin, are incredibly common but often preventable. Proper hygiene, gently cleaning under the foreskin, avoiding harsh soaps, and keeping the area dry can make a world of difference. The skin on the penis is delicate, so aggressive scrubbing or using strong scented cleansers can cause irritation or micro tears, leading to infections or discomfort. The rule is simple: treat the skin on your penis the way you treat the skin around your eyes, gently, with respect, and without overdoing it. Then there's the issue of safety, not just in hygiene, but in sexual health. I can't emphasize this enough: safe sex is sexy sex. When you and your partner feel secure, free from the worry of sexually transmitted infections or unintended pregnancy, you can truly relax and connect. Condoms remain one of the most effective ways to protect yourself and your partner, but many people avoid them because they believe they reduce pleasure. The truth is, with the right fit and type, condoms can be comfortable and almost unnoticeable. There are ultra-thin options, textured ones, latex-free varieties. You just need to experiment and find what works best for you. Control is another essential part of safety, particularly during sexual activity. I've seen too many cases of penile fractures in the emergency room, a painful and serious condition that happens when an erect penis bends forcefully during intercourse. It's a true surgical emergency. If you hear a popping sound, feel immediate pain, or notice your penis swelling and bruising, it's time to head to the ER. The good news is that when repaired promptly, most men recover full function. But waiting or trying to tough it out can lead to scarring and long-term erectile dysfunction. The best prevention: maintain control during sex, especially during vigorous activity. It's perfectly fine and actually smart to slow down, adjust positions, or hold your partner's hips to manage movement and prevent injury. Lubrication is also a simple but powerful way to protect penile health. A well-lubricated experience reduces friction, prevents microtears, and enhances pleasure for both partners. There's absolutely no shame in using lube. In fact, It's one of the easiest ways to make intimacy more enjoyable. As we age or as our partners experience hormonal changes, say such as menopause, natural lubrication can decrease. Even medications or stress can contribute. Remember, needing lubricant isn't a sign of dysfunction. It's part of healthy, mindful intimacy. And speaking of heat, let's talk about something that often gets overlooked: temperature. The testicles are designed to hang outside the body because they require a slightly cooler environment than the rest of your organs to produce healthy sperm. Excess heat, whether from hot tubs, saunas, or laptops resting on your lap, can reduce sperm count and even lower testosterone production over time. If you're trying to conceive or simply want to protect your fertility, avoid prolonged exposure to high temperatures and keep electronics away from your growing area. Even small changes like switching your phone to a back pocket instead of the front can help. Now, let's address a behavior that many men don't realize can cause harms: aggressive masturbation. I've seen patients who unknowingly desensitize their penis by using what's called the death grip, an overly firm hand technique that creates intense pressure not replicable during partnered sex. Over time, this can condition your body to respond only to that specific sensation, making it difficult to become aroused or maintain erections during real intimacy. My advice: be kind to your body. Masturbation is a healthy, normal part of sexual well-being, but it should mimic natural pleasure. Use lubricant, slow down, and focus on enjoyment, not performance. Sexual pleasure should never feel rushed, painful, or mechanical. Then there's the larger picture of health. Your penis doesn't exist in isolation. It's deeply connected to your cardiovascular system, hormones, and mental state. Smoking, for example, is one of the fastest ways to damage your erections. It narrows blood vessels, decreases blood flow, and over time can lead to irreversible erectile dysfunction. I've treated countless men with bladder cancer linked directly to smoking, and the impact is life-altering. Similarly, excessive alcohol or drug use can impair blood flow and nerve function. The truth is, what's good for your heart is good for your penis. A diet rich in fruits, vegetables, lean proteins, and healthy fats support circulation, hormone balance, and stamina. Exercise, both cardiovascular and strength training, plays a vital role as well. Aerobic exercise improves blood vessel health, while resistance training supports testosterone production. You don't have to overhaul your life overnight. Start small. Take a 20-minute walk, swap soda for water, or commit to going to bed 30 minutes earlier. Those little choices add up. Stress management is another piece of the puzzle. Chronic stress raises cortisol levels, which can reduce libido and interfere with erectile function. While some stress is normal and even motivating, constant tension wears down your body and mind. If you find yourself constantly anxious, especially about sexual performance, it might be time to explore mindfulness, therapy, or even simple relaxation techniques like deep breathing or yoga. As a urologist, I can assure you that your penis doesn't function in a vacuum. It responds to the entire ecosystem of your physical and emotional health. And finally, be gentle with yourself. I've met so many men who become their own worst critics when things don't work perfectly. Maybe they couldn't get an erection once, and suddenly they're filled with dread the next time. That anxiety compounds, leading to more performance issues, a vicious cycle that has nothing to do with physical dysfunction and everything to do with psychological stress. You're human. Your body isn't a machine. Every man experiences fluctuations in desire or performance, and it's nothing to be ashamed of. The most powerful thing you can do is show yourself compassion and seek help if you need it. Sexual health isn't just about mechanics. It's about confidence, communication, and care. In the next and final chapter, I'll share how maintaining an active, connected sexual life doesn't just support your physical health. It can actually preserve your penile tissue, protect against shrinkage, and even improve your overall longevity. Yes, who's it or lose it has more truth to it than you might think. As a urologist, one of the most common questions I get from men of all ages is whether the phrase "use it or lose it" is true when it comes to their sexual health. The short answer: yes, but not in the way people often think. Your penis, like any other part of your body, thrives on good blood flow and regular activity. Erections aren't just for pleasure. They're an essential biological function that keeps the tissue oxygenated, elastic, and healthy. When erections stop happening, whether because of stress, low libido, relationship changes, or medical issues, that lack of oxygenated blood flow can actually lead to subtle structural changes in the penile tissue over time. Here's what that means. Most men experience 3 to 5 erections every night during sleep, even if they don't notice them. These nighttime erections play a crucial role in maintaining the health of the erectile tissue. They're your body's natural way of exercising the penis, keeping the muscles engaged and the blood vessels open. If those erections stop occurring for an extended period, it can lead to tissue scarring, reduced elasticity, and even a mild shortening of the penis. It's not immediate, but it's real, and it's one of the reasons why regular sexual or erectile activity, even if it's through masturbation, is a healthy and normal part of maintaining function. That said, using it doesn't mean pushing yourself or treating sexual activity as a chore. It means staying connected to your body, your partner, and your sense of pleasure. When I counsel men who are struggling with low libido or performance anxiety, I emphasize that intimacy is about much more than penetration or orgasm. It's about connection, trust, and vulnerability. Those elements don't just make sex better, they make it healthier. When you're comfortable, emotionally open, and not preoccupied with performance, your body is more likely to respond naturally. Sometimes, however, a drop in libido or erectile function isn't just psychological, it can have hormonal or physiological roots. Testosterone, for instance, plays a vital role in maintaining sexual desire, energy levels, and muscle mass. Low testosterone can make it harder to feel desire or sustain erections, but it's also linked to mood changes, fatigue, and even brain fog. If you notice that your interest in sex has dramatically declined or you're feeling persistently low, it's worth talking to your doctor about checking your hormone levels. A simple blood test can reveal a lot. Another factor that contributes to erectile health is communication, both with yourself and your partner. Many men who experience sexual changes feel an overwhelming sense of shame or failure. They withdraw emotionally, which only deepens the problem. But here's what I tell my patients. Sexual health is just another part of overall health. If your knee hurts, you wouldn't feel embarrassed to tell your doctor. If your vision blurs, you'd see an eye specialist. Your sexual organs deserve that same care and respect. The more you talk about it, the faster we can find solutions, and there are so many effective treatments available today, from oral medications and lifestyle changes to newer regenerative therapies. It's also important to understand that desire changes naturally over time. Relationships evolve, hormones fluctuate, and life gets stressful. That doesn't mean something is broken. It just means your body and circumstances are shifting. If you're in a long-term relationship, maintaining intimacy requires intention. Sometimes that means scheduling time for connection, even if it doesn't always lead to sex. Other times, it's about exploring new ways of being intimate through touch conversation or mutual exploration. The more you stay open and curious, the easier it is to maintain sexual closeness. One area that's often overlooked in conversations about penile health is the emotional toll of sexual difficulties. I can't tell you how many men I've met who carry silent anxiety, guilt, or shame about changes in their sexual performance. They internalize it as a reflection of their masculinity, when in reality, these issues are incredibly common and often treatable. Being kind to yourself is one of the most underrated aspects of sexual health. The more you pressure yourself to perform, the more you activate the body's stress response, which is the exact opposite of what helps an erection. When you feel anxious, your body releases adrenaline, constricting blood vessels and diverting blood flow away from the genitals. So the next time you find yourself overthinking in the moment, take a breath. Remind yourself that this is natural, that no one's body works perfectly all the time, and that intimacy isn't a test, it's a shared experience. What I want every man to understand is that sexual health and self-worth are deeply intertwined, but they're not the same thing. You are not defined by the strength of your erection, the size of your penis, or how often you have sex. You are defined by how you take care of yourself, how you nourish your body, manage your stress, communicate with your partner, and show up for your own well-being. That's what true sexual confidence looks like. So yes, who's it or lose it carries a grain of truth. Regular sexual activity, whether solo or with a partner, does help maintain tissue health and circulation. But more importantly, it keeps you connected physically, emotionally, and psychologically. Intimacy in any form is part of what makes us human. It strengthens relationships, improves mood, reduces stress, and can even boost immunity. Studies have shown that regular sexual activity is associated with lower rates of cardiovascular disease and longer life expectancy. In many ways, taking care of your sexual health is taking care of your overall health. As we wrap up, I want you to take away one key message. Your penis is a reflection of your entire body's health. Treat it with respect, curiosity, and care. Don't ignore warning signs. Don't fall for unsafe trends. And don't be afraid to seek help when something doesn't feel right. Good penile health isn't about perfection. It's about awareness, prevention, and compassion for yourself. At the end of the day, your sexual health matters because you matter. When you take care of your body through exercise, proper diet, safe sex, regular checkups, and honest conversations, you're not just improving your erections, you're enhancing your quality of life. And remember, as I always tell my patients, take care of yourself because you are absolutely worth it.